Welcome to the podcast, The Benefit Whisperer, with your host, Ralph Weber. Ralph, good to be with you again. What's on the table for today's episode?
Great seeing you too, Bill. Today, we're going to actually get a little bit into the weeds on a specific...
Not too deep, though, right? We're not going to go into the... No.
Not too deep, no.
Okay.
We're going to get into a benefit plan called a level funded plan. It's specific. It's mostly for small employers. And by small, I mean less than 100, which to a lot of people is not small. But there are 98.1% of all registered U.S. businesses have fewer than 100 people. So it's a lot of businesses that could harness this kind of thing.
Yeah, there's a lot of people. And, it gets said a lot by economics reporters that small business is the primary employment driver in the U.S. economy. I don't think people quite register that as effectively as that statistic you just gave. 90+% of employers are small business employers.
Absolutely. 89% have fewer than 20. So 98%, and this always gets mixed up because it's reverse.
Yep.
98% have fewer than 100, 89% have fewer than 20.
Incredible. So anybody who is a small business owner should be paying attention to this if they're thinking about employee benefits.
Yes, absolutely. Absolutely. And, in the U.S., we spend about twice as much as any other industrialized country on healthcare. Okay. And that affects small businesses because it's gotten to the point where the average family premium is about $21,000 to cover a family. Wow. Wow. So you might as well just say, hey, I'm just going to add $2,000 a month to Bill's salary on the budget because that in effect is what's happening. So, small businesses especially have a hard time finding affordable benefits. So this is a really good way to do that.
Well, I'm all ears. Okay. Level funding?
Yeah. Level funding is what it's called. So first of all, let's start at the very, very high level. There are two kinds of benefits plans, a fully insured plan and a self-insured plan. Self-insured, also called self-funded, self-insured. Okay. Those are the two divisions. In 1946, there was an act called the McCarran-Ferguson Act that passed. And up until that point, the federal government regulated all healthcare, health insurance plans. In 1946, it was sent to the states to regulate that. And that's why you hear all these politicians talk about buying insurance across state lines, because different states have different mandates that they have to cover. When the Affordable Care Act passed, it said each state shall set its own essential health benefits level of coverage. Now, there are 10 essential health benefits, things like prescription coverage, hospital coverage, mental health coverage, doctor's visit, et cetera, et cetera. So there were 10 main categories. Each state said you're going to cover this way, this one this way, et cetera, et cetera. Self-insured health plans are regulated by the federal government, by the Department of Labor under the laws of ERISA. Okay. When the ACA passed, they never said, and the federal government for self-insured plans shall set essential health benefits. So they never were required to. Okay. So since the ACA passed, it's created this big divide between fully insured plans and self-insured plans. And level funded is just one kind of a self-insured plan. So these self-insured plans don't have to set the essential health benefits. The minimum coverage is defined as minimum essential coverage, which is just really only preventive care. And we'll talk about that on another episode. But after that, you can kind of like building your own house. You can take those essential health benefits and you can say, for example, I'm not going to cover this. For example, mental health. I'm not going to cover prescription drugs. I'm not, you can carve out anything you want, which you can't on a fully insured plan. Now, that allows you a lot more flexibility as an employer to cover those things a different way.
So it's not that you aren't providing prescription coverage or mental health coverage. It's that you're coming at it from a different way and a different perspective. Is that right?
That's exactly right. With a fully insured plan, it's kind of like a sealed capsule. Okay. And you've got 5 big insurance companies left after the ACA: Blue Cross, United, Cigna, Aetna, and Humana. Those are really what it boils down to. And that doesn't leave for a lot of competition. Now, when the ACA said every insurance company has to offer guaranteed coverage to small businesses and individuals, no matter of their health, prior to the ACA, in different states, they were able to underwrite coverage. And what that means is they ask health questions. Now, Bill, you know, when somebody applies for life insurance, if you're a 24-year-old athlete, you're going to pay less than if you're even a 24-year-old overweight person with diabetes that maybe is 200 pounds overweight. Everybody knows that. Okay.
Right.
So in health insurance, that used to be the case. With the ACA, it wasn't. They said the same rate for every, other than age differences and plan differences and zip code differences, et cetera, when you first issue the policy. Okay. So what that means is, surprise, surprise, instead of bringing it down to the middle, they brought it closer to the top. Okay. So the unhealthy groups were paying maybe a tiny bit less than they used to, but they were able to get coverage. They were before too with high risk pools, but that's a whole different story. However, the bottom of the market, meaning the healthy groups, which is more than 75 or 80%, they ended up paying more. Okay. Now, to a degree, their spread of risk, I get that. Okay. But their costs rose substantially. Okay. The second thing was the compression ratio. Okay. What that means is, prior to the ACA, you could charge a 64-year-old 8 times as much as a 24-year-old. Okay. Under the ACA, that changed to 3 times, 300%. So again, they didn't bring down the cost for the 64-year-old. They brought up the cost for the 24-year-old. So we're scaring all of these young, healthy people out of the marketplace. And, you know, the older, less healthy people are benefiting, which is great. Okay. However, it leaves a lot of small employers, especially those that have healthy workforces. And some examples are the male-dominated industries, because guess what? Guys don't go to the doctor because we're bulletproof, right?
Yeah,
you know?
No.
Not that we're necessarily more healthy, but, you know, guys go less. So industries such as automotive and construction and that, they are generally good demographics. Okay. But if they're thrown into the same insurance pool as other employers, they're paying a lot more. Mm-hmm. The other thing about level funding is you get a refund at the end of the year for any unused claims fund. Okay.
No, you can't just stop and say, okay, Ralph. What do you mean you get a refund?
Okay. So the premium is made up of 3 numbers. Okay. There are the administrative fees.
Okay.
There is stop loss insurance coverage. Okay. Which, unless you're an employer the size of Walmart or Boeing that has hundreds of thousands, if not millions of employees, you need stop loss coverage, and that protects from the large claims. So you've got admin, you've got stop loss, and then you've got the claims fund.
Stopwatch, I'm assuming you mean like a high deductible plan, right?
Yeah, correct. So
okay.
I was just speaking to an employer just before this show. They are on the West Coast. They have 46 employees. Now, their coverage broke down to about 50% for fixed costs. And those fixed costs are admin and stop loss premium, and then 50% for the claims fund. Okay. So over the year, their claims fund they put $300,000 in their claims fund. Now, the last 2 episodes, I talked about one of my favorite people. I almost said Marty Feldman. The other, the economist. Oh, I can't believe I got that wrong. Milton Friedman.
What the heck? I think Milton would be amused by that. Okay?
Yeah, I think so. So Milton Friedman, you know, as I've told you, he said there's 2 kinds of money: your money and my money.
Money.
And there are 4 ways to spend it. Now, as an employer, as a small employer, if you sit all your employees in a room and you say, hey, listen, guys, you know, healthcare is expensive. Okay. I want to take care of you. I want to allow you a chance to help to take care of your families. Okay. Because you're our family, because we're a small employer. We've got 20, 40, 80 people. So I want to do this, but we have to do it cost effective. Now, if you buy a fully insured plan through one of the big insurance companies, you're sending money to them and then you're spending their money. Now, when you spend, like if I spend your money, you spend my money, as we talked about, we don't have the same level of diligence and stewardship that we do when we're spending our own money.
Right.
So you say to your employees, okay, look, guys, you're family. We're all family. Okay. We're all in this together. We're helping each other with each other's struggles. And we're all putting money into this pool every month. Okay. And one bucket allows this plan to be administered effectively. Another bucket is stop loss premiums. If anybody should have a huge claim, it's going to cover that. But that third bucket, that's the one where your contribution, Bill, pays for my twisted ankle. My contribution pays for your annual physical. Okay. So we're all paying for each other's health care. We're spending our own money. Okay. So we have to be careful of how we spend it. Now, it is insurance. So if you have a large claim, you're covered. You don't have to worry about that. But for the stuff that we can control, we're going to get the ability to keep our premiums sustainable over time. Okay. And I have, one client that I think I told you about before. Every single year for the last 3 years, we have reduced their costs by an average over the last 3 years, roughly 6 or 7% compounded per year.
I'm intrigued by this because it sounds like a level funded plan creates an incentive for the employer and the employees to maybe develop better health habits.
It absolutely does. Yes, absolutely, Bill. It does, because now we're spending our own money. Okay. We want to keep it sustainable. Potentially the plan, the refund part of the plan, if we roll it into future years, it's kind of like dividends. The plan pays dividends to the future, keeping our costs low. So the healthier we are, the more we take care of ourselves, the lower our costs are, the lower our health care is over the years. So instead of the employer coming every year and saying, hey guys, sorry, the deductible went up by $1,000, your copay went from 25 to 35, we're adopting a narrow network, these kinds of restrictive top-down controls. Instead of the employer having to come up with that, the employer can say, hey, guess what? We had to enrich the plan this year. We got some dividends from last year, so we're dropping the copay. We're adding a wellness incentive program. We're adding all these kinds of things, and employers can really proudly add these kinds of things year after year.
In my mind, this sounds really good, Ralph, but in my mind, because I do have a bit of a skeptic in me, and I'm thinking, how has the response been at the companies you've worked with? Because I can see some employees not caring. I can see some employees going, I don't care.
That happens.
Yeah. I mean, how do you deal with that? Or do you even have to?
You really don't have to, because I think that, call me Pollyanna glasses, but I like to think that most people do care. Most people do. Right?
Oh, I know. I think I agree with you on that. I don't think that's Pollyannish. I think most people do care, but I've been around long enough to know that there always seems to be somebody who's like, I don't care.
Yeah, no, exactly. There will be, but those employees are going to probably present you with different kinds of problems as an employer anyway. Okay. So level funded. Okay. The reason it's called level funded as opposed to just self-funded or self-insured is because I said it was kind of a subdivision. What happens with a level funded plan that's slightly different is, number one, what you're paying is your maximum costs. Okay. Employers out there think sometimes that self-funded health plan, self-insured health plan is high risk. Okay. There's risk involved. So what they do is they charge you the maximum. Okay. The underwriter that looks at the risk, they look at the ages, they look at the health conditions, because sometimes, depending on the size of your group as an employer, sometimes you have to answer, some eight or nine basic health questions. So when they look at the relative health of the group, okay, they set the expected claims. Now, let's say those expected claims for a group, let's say you've got a group of, 20 people and they say the expected claims are $100,000 for the year.
Okay.
Then they add what's called the risk corridor, and that can be anywhere from 10 to 25%. So let's just use 25%. They add 25% onto your expected claims, and that's your maximum funding. Then they put the stop loss insurance over top of that. So once your claims exceed $125,000, for example, your aggregate stop loss kicks in and the insurance pays the whole thing. Now, there's a second kind of stop loss insurance too. Okay. There are two types in many level funded plans. Many of them have aggregate only, but some of them have what's called traditional stop loss, which consists of specific and aggregate. Okay. So what the specific does is if any specific person or family group has a large claim, the specific stop loss will kick in. Okay, so let's say your self-funded pool is, in that example that I gave, $125,000, and let's say the specific stop loss kicks in after 20 grand. So if you have a group of 10 people, one person has $1 million claim, and everybody else doesn't go to the doctor, doesn't get a prescription filled. Of that $125,000, $20,000 is paid. But then once you hit that stop loss limit of 25, it all goes to insurance. So you still get $105,000 back at the end of the year, even though you had way more claims than your claims fund, but that stop loss protected your claims fund.
Well, this is really intriguing. And I think if I owned a small business, this is an option I would definitely want to look at, because like I told you, I believe in our last episode as well, I have friends who own their own businesses, and I know that this is a annually for them.
It is. And, I've talked to employers every single day. That's what I do. I've talked to employers that jump around from plan to plan to plan. One here locally, they have a total of about 370 employees, but they've got about 85 or so in their salaried staff. Okay,
right.
Those people had over the last 3 years 3 different plans. The first one was a self-funded plan, traditional, normal, regular self-funded plan. Then the next year they had a level-funded plan with no network. Okay. And we'll get into that in another episode too. Way too much to get into. And then the third year, they had a fully insured plan. Now, when that fully insured plan renewed, their premiums went up from 800,000 a year to $1 million. Okay. Big increase, almost 25% increase. So they had a fully insured plan. They had this huge increase that they had to deal with. But they changed so many plans that they were just fatigued and burned out from changing from plan to plan to plan to plan. Once you get into a good, solid, level-funded plan, you can tweak it from year to year, change the network, change the stop-loss limit, change the copays, the deductible, et cetera, and those dividends keep rolling in. The other thing is that in every state in the U.S., with the exception of Texas, if you have a small group, you can't have any access to your claims. And as I spoke about in the last episode, there are huge variations in what providers are paid. And you have no access as a small employer to see what were your claims. I paid $100,000 in premium. How much did you pay in claims? Was it $10,000? Was it $1 million? You have no idea. Texas does allow you to see that as an employer, but in no other state. With a self-insured plan or a level-funded plan, you get access to that information. The other thing, and this is really, really important to mention, is that claims fund that I talked about, okay, whatever's not used from that, you should get 100% of that back or rolled over. Okay, that's very important. So when you're looking at this kind of plan, make sure that it has 100% refund of it. The self-funded plan is portion of the plan is called plan assets. So make sure that you're entitled to have some visibility to see what the claims are, and that you get 100% refund of your plan assets.
So let's go back to your example of $125,000.
Sure.
Is that the bucket, or what is that?
Yeah, that's the bucket. So, let's look at a plan as having three buckets. One is the administration costs, one is the stop
Yep.
loss premium, and one is the claims fund. Okay. So that's the amount that goes into the claims fund bucket.
Okay.
Okay.
Just to keep things really simple. So you have 10 employees and, you got, I'm trying to think what it would be. Let's say $2,000 a person, in terms of cost over the year. So there'd be $20,000 in terms of cost out of that bucket
Per month. Yep.
Okay.
So using that example, your total costs, and that's if everybody's got family coverage, is about $250,000, 240,000. Of that, let's say 125,000 is in that self-insured bucket, that claims bucket. Okay.
Yeah.
The other stuff, it's like I said, it's the stop loss premium, the admin cost. And if nobody goes to the doctor, you still have to pay that. But that 125,000 potentially is 100% refundable. Now, mathematically, you're never going to get 100% back.
Right.
But chances are that at least 3/4 of the time, you're going to get at least something back. And in some cases, it could be quite substantial.
What do you typically advise those owners to do? I'm just kind of curious. I guess it varies by, on individual bases, but it strikes me that if I'm an employer and I have the opportunity to roll that over, I have a way of sort of stabilizing my cost.
Exactly. So let's say you get a plan on year one. Okay. You pay the maximum funded costs. Okay. And that claims fund is $125,000. Let's say you get back 50,000. Okay.
Okay.
So the next year, instead of paying 125,000, you roll over the 50. Okay. And guess what? You only have to pay $75,000. So you've reduced the cost with your dividends. They carry forward.
Wow. Now, what happens if I exceed it?
Great question. That's where some employers think that there's risk. With a level funded plan, your maximum funding. Okay, so you're paying the maximum liability. Stop loss kicks in after your maximum liability. So if everybody has a huge claim or a huge majority of your people have a large claim, you don't have to pay any extra. As long as your plan is set up as a maximum funded plan, you don't pay any extra. Now you won't get a refund, okay?
Right.
But you don't have to pay any extra.
And presumably in the next year you're going to pay more because your maximum obviously is increased.
Exactly. Just as you would with a fully insured plan. You still have a chance to play with your stop loss levels though too going forward. Now most employers don't have a bad year every single year. And a bad year, what I mean is high claims. They don't have a high claims year every single year. Most health claims they don't go on year after year after year after year. Some do, but most don't. Most are like a complication during childbirth, a cancer, a heart attack, like things that are catastrophic, but are usually limited in time.
Very interesting. For the employers who are listening to this, who are intrigued by this concept and this idea, Ralph, what is the best way for them to get a hold of you to have a conversation about this and their particular case?
Well, probably the best way is by email or phone. You can call us 832-924-3330 or visit thebenefitwhisperer.com. Send me an email, ralph@thebenefitwhisperer.com, and let's start a conversation. Level funded is not right for every single employer. It's not a silver bullet. It doesn't work 100% of the time with 100% of the employers, but it probably works most of the time for 75 to 80% of the employers. So chances are that it could work very well for you.
Yeah, no, and I would encourage anybody who's listening to this who is in the middle of wrestling with employee benefits and how they can take care of the people who work for them to give you a call. And I think, Ralph, you're great. You lay that out with the understanding that it's like, this may work for you. This may not work for you, but if it doesn't work for you, Ralph, are there other approaches you can recommend?
Absolutely. The three that come to mind, number one is individual employees can always get individual insurance on the exchange, which is open for enrollment once a year for a couple of months. Okay. You as an employer can actually have a plan, which we'll talk about in a future episode, called an ICRA or a QSERA. ICHRA stands for Individual Coverage Health Reimbursement Account. QSE, HRA is Qualified Small Employer Health Reimbursement Account. So you can actually say, hey guys, go to the exchange, get your own thing, and I'm going to reimburse you. The other option, of course, is a fully insured plan, which every employer has access to. Now, you have to meet participation requirements usually with a fully insured plan,
Right.
But you can get it. Now, the other thing I just thought of this as I was saying this. Sometimes you have, and I talked about this employer where they had 370 people and about 85 or 90 were on this level funded plan. Employers usually have different classes of people. It could be salaried versus hourly. It could be, office versus teaching staff. It could be, one of many things that's non-discriminatory. Okay. If you can set a class of people and you can say, for this class, I want the following set of benefits. For this other class, I want the following set. Then you can really kind of split it up. Some of these plans, their participation levels are less than they are with fully insured plans. For example, if you have fewer than 25 employees, we can often set up a plan with as few as 5 of them. You don't need to hit that 50% margin. And if you have 100 employees and 20 of them are office/management, you set up a plan just for those, 10 or 20 employees, and you get 5 of them that want in, you've got enough for a plan. So there's a lot more flexibility with level funded plans than there is with fully insured plans.
No, that's intriguing and fascinating. Thank you, Ralph. Again, I would encourage you to reach out to Ralph at thebenefitwhisperer.com. Have further conversation with this to see if level funding might work for you. And if not, what might be the best.
Absolutely.
You can only have a conversation to find that part out. So I would encourage you to do that.
Exactly.
The other thing I'd encourage you to do is that if you are not yet a subscriber to this podcast, become one. Hit the follow button. That way, when Ralph drops a new episode, you don't have to remember where or when you heard it or how often he drops new episodes, because you're going to be notified and you will never miss another episode. It's that simple. And if this information is interesting to you, is useful to you, I would ask that you share it with people.
Absolutely.
Let them know about it as well. Talk about this podcast. Word of mouth promotion is a really effective tool, and we'd very much appreciate it. Until the next time, I'm Bill Tucker. On behalf of Ralph and everybody at Route 3, thank you for taking the time to listen today. And I personally will remind you that you can go out today and make today a great day. Or not.
Thanks, Bill.
Thank you, Ralph. And remember, as always, it's your choice about what you do with your day. Until next time.
Thank you for listening to the Benefit Whisperer podcast. Click the follow button to be notified when new episodes become available. Looking to reach out? Visit our website at www.thebenefitwhisperer.com or give us a call at 832-924-3330. And don't forget to click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of the Benefit Whisperer. The content has been made available for informational and educational purposes only. The content is not intended to be used as a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning.